Why does ginger, a plain root, have such a big impact on us? It might make bleeding worse or help with morning sickness during pregnancy. Let's explore the facts, how doctors use it, and why people have been using ginger for so long. When we understand how ginger's parts work in our bodies, we see why it's both helpful and harmful. How do we figure all this out? Let's explore together to make wise decisions about what we eat and how we stay healthy. Number 1. Bleeding problems. If you have trouble with bleeding, like cuts that take a while to stop, it's best to avoid eating ginger. Ginger can slow down blood clotting, which might be risky if you already have bleeding issues or take blood-thinning medications. Before adding ginger to your diet or taking supplements, talk to your doctor. It's important to get personalized medical advice, especially if you have bleeding problems or take blood-thinning meds. Working closely with your healthcare team helps you choose safe foods and understand any risks from herbal medicines like ginger. Number 2. Gastrointestinal problems. Digestive problems can include issues like acid reflux, gastritis, and conditions like Crohn's and colitis. While ginger can help with nausea and inflammation, its spiciness and ability to increase stomach acid might worsen symptoms for some people with sensitive stomachs or specific gut issues. If your tummy troubles you, it's important to work with your doctor and a food expert to plan a diet that suits you. Ginger could help some people but make others feel worse. Figuring out which foods are good for you can really help you control your tummy problems. Number 3. Pregnancy brings big changes to a woman's body to support the growing baby. During pregnancy, what you eat matters a lot, and ginger is a popular topic when it comes to pregnancy diets. It's generally safe and can help with the nausea and vomiting many pregnant women experience, especially in the morning. But it's important to not overdo it. Having too much ginger, especially in strong forms like supplements or teas, might have risks during pregnancy. It could affect the baby's development or cause more contractions in the uterus. So, it's smart for pregnant women to talk to their doctors before adding ginger to their daily routine. Getting professional advice helps them make choices that keep both themselves and the baby healthy. Number 4. Surgery. Before surgery, it's important to prepare carefully, including thinking about what you eat and how it might interact with your body. Some advice suggests avoiding ginger before surgery because it can thin the blood and affect stomach acid levels. If you're getting ready for surgery, especially if it involves bleeding risks or your stomach, it's important to follow your healthcare team's advice. While ginger is safe for many and can help reduce inflammation after surgery, its effects on blood clotting and stomach sensitivity mean you should be careful. Talking openly with your healthcare providers about your diet, including any herbs like ginger, can help your surgery go smoothly and improve your recovery. Number 5. Certain medications. Some medicines can react with foods, herbs, and supplements, which might change how well they work or cause bad effects. If you take certain medications, you might need to be careful about eating ginger. This is because ginger can affect how your blood clots and how your liver breaks down some drugs. For example, if you're taking medicines to thin your blood or prevent clotting, like warfarin, ginger could make you bleed more. Also, if you're on drugs that your liver processes, like some antiviral or anti-seizure medicines, eating a lot of ginger might affect how well those drugs work. If you're on medication, it's important to talk to your doctor or pharmacist about whether you should avoid certain foods like ginger. They can give you advice based on what medicines you're taking, your health, and what you eat to make sure you stay safe and your treatment works well. Number 6. Diabetes. Eating right is key for managing blood sugar levels in diabetes. Ginger, known for its anti-inflammatory and antioxidant benefits, could also be helpful for people with diabetes. Studies show it might help insulin work better, lower blood sugar levels, and ease diabetes-related issues like inflammation. But it's important for people with diabetes to have ginger in moderation and with guidance from their healthcare team or dietitian. Especially in strong forms like supplements, ginger could interact with diabetes meds and make blood sugar drop too low, hypoglycemia, if taken too much. So it's smart for people with diabetes to check their blood sugar levels carefully when using ginger and talk to their healthcare team to make sure it fits well with their diabetes plan. Using ginger as part of a balanced diet, along with regular checks and medication, can help manage diabetes better and keep you healthier overall. Number 7. Low weight. People. Eating right is super important, especially if you have trouble keeping a healthy weight. Ginger can help with digestion and might make you feel hungrier, but it's best to talk to a doctor before using it a lot. Having too much ginger can upset your stomach and not help with gaining weight. Also, it doesn't really make a big difference in weight gain on its own. If you want to gain weight, eat healthy foods with lots of nutrients, protein, good fats, and carbs. Exercise can also help build muscle. Getting advice from a dietitian or doctor can create a plan that's right for you and includes ginger or other natural things safely. Number 8. People who consume certain herbs. If you usually use ginger or other herbs, it's important to know how they can affect your health and medications. While ginger is generally safe and helpful for inflammation and digestion, it can cause issues with certain drugs or conditions. For example, if you take blood thinners like warfarin or aspirin, ginger might increase bleeding. And if you have gallbladder problems or ulcers, ginger could worsen symptoms. Make sure to tell your healthcare team about any herbs you use regularly, so they can make sure they won't cause problems with your medications or health conditions. Working together with doctors, pharmacists, and herbalists helps find the safest ways to use herbs like ginger, considering your specific health needs. Number 9. Blood disorder. For people with blood issues like hemophilia or thrombocytopenia, what they eat matters a lot to stay healthy. Some foods, like ginger, can be tricky because they might affect how blood clots. Although ginger is good for inflammation and the heart, it can mess with clotting and platelets. So, if you have a blood problem that messes with clotting, eating lots of ginger or strong ginger supplements might make bleeding more likely or interfere with clotting meds. It's important to work with doctors to figure out a diet that's safe and healthy. Sometimes having a little ginger in your diet is okay, but it's best to watch carefully, especially if you're taking clotting meds. Talking openly with your healthcare team helps make sure your diet, including ginger, helps you stay healthy while dealing with your blood disorder. Number 10. High blood pressure. High blood pressure, known as hypertension, is a common health issue worldwide, but your diet can help manage it. Foods like ginger might affect blood pressure, though we're unsure how directly. Some studies suggest ginger might lower blood pressure by widening blood vessels and improving blood flow, but more research is needed. If you have high blood pressure, be careful with ginger, especially if you take blood pressure medication. Having a little ginger in your diet can be good, but having too much or taking strong supplements might mess with your medications or make your blood pressure go up and down. It's wise to consult with a doctor or dietitian before adding ginger to your diet if you have hypertension. Monitoring your blood pressure and ginger intake can help manage hypertension and maintain heart health. Number 11. Visual sensitivity. Some people are really sensitive to what they see, like bright lights or certain patterns. We're not sure how foods like ginger affect this sensitivity. Ginger is known for being good for your body and eyes because it fights inflammation and has antioxidants, which might help with eye problems. But not everyone reacts the same way to ginger, and some might have stomach issues from eating it. If you're worried about sensitivity to what you see, it's best to see an eye doctor. While adding ginger to your diet might be good for your health, talk to your doctor first to make sure it's okay for you. And remember, protecting your eyes from bright lights or screens can also help with sensitivity. Number 12. Irritation of oral mucous membranes. Sometimes your mouth can get irritated from things like dental issues or allergies, a condition called oral mucositis. Ginger, with its spicy taste, can make this irritation worse if you have a lot of it, causing a burning or tingling feeling in your mouth and throat. While most people are okay with a bit of ginger in their food, some may feel uncomfortable, especially if they have a sensitive mouth or existing mouth problems. Rinsing your mouth with water or a gentle mouthwash can help if ginger or any food makes your mouth feel weird. Eating less ginger or mixing it with other foods in your meals can also reduce irritation. If your mouth keeps feeling irritated or sore, it's a good idea to see a dentist or doctor to figure out what's causing it and get help. Taking care of your mouth and watching what you eat can help keep it healthy and make you feel better overall. As we finish talking about ginger, we've learned it can help with different health issues, from pregnancy discomfort to affecting blood clotting and medicines. It's important to be careful with ginger, especially if you have health concerns or take medicines regularly. Let's keep discovering the benefits of natural remedies like ginger that keep us healthy. Keep learning and take care of yourself. Before you start using ginger in your diet or as a supplement, talk to your doctor about how it might work for you, especially considering your health and any medications you take. Whether you have issues with bleeding, digestion, pregnancy discomfort, preparing for surgery, or specific medical conditions like diabetes or blood disorders, it's important to make informed choices. Pay attention to how your body responds to ginger, adjust how much you use if needed, and stay informed about its benefits and risks. Let's team up to explore how ginger can help us stay healthy and balanced. Thanks for joining us on our ginger journey. If you found this video helpful, remember to give it a thumbs up, share it with your friends, and subscribe to our channel for more health tips. We're excited to keep bringing you valuable information to help you stay healthy and informed. Stay tuned for our next video, and until then, take care and see you soon.